Understanding the short-term side effects of Suboxone. Long-lasting opioid withdrawal symptom side effects can be brutal to shake off. However, the notion that a different type of medication used to treat those aggravating symptoms may lead to additional side effects is daunting. This video will look into the side effects of Suboxone and get your mind off the worries that may be clouding your judgment and preventing you from getting treatment. It will help you make an informed decision about your treatment options. Suboxone is a prescription medication for treating opioid use disorder. It combines two active ingredients, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist which binds to the same receptors in the brain as opioids such as heroin and oxycodone. It helps reduce cravings and withdrawal symptoms. Naloxone is an opioid antagonist which reverses and blocks the effects of opioids. It is added to Suboxone to deter opioid addiction. It prevents opioid withdrawal symptoms by clinging to the mu-opioid receptors in the brain and central nervous system, relieving symptoms. Suboxone is part of a medication-assisted treatment, or MIT, used with behavioral therapy and counseling to treat opioid addiction, also known as a dual diagnosis treatment. MIT can ensure you get the best long-term option for your addiction. Suboxone is a sublingual film or tablet that dissolves under the tongue. The onset of action is rapid, and the effects can last up to 24 hours. Once dissolved, do not eat or drink for at least 15-30 minutes. You mustn't chew or swallow the sublingual film, reducing its effectiveness. You should also avoid spitting out the medication, reducing its efficacy. As part of MAT, Suboxone is combined with therapy and other interventions to ensure its best long-term outcome. With the help of this treatment, you can focus on your sobriety and avoid any relapses from the symptoms of opioid withdrawal. Suboxone can be used in a few different ways, depending on the severity of the addiction. It can also be a tapering method to help you wean off opioids altogether and better control opioid effects. Much like any opioid, Suboxone may have side effects. These are some of the common side effects: dry mouth, headache, stomach pain, stomach upset, sway, sleeping difficulty, drowsiness or fatigue, nausea or vomiting. These effects usually go away after a few days as your body gets used to the medication. However, immediately contact your Suboxone doctor if you experience severe side effects. The short-term effects of Suboxone can be both positive and negative. The positive short-term effects are that it eliminates withdrawal symptoms and cravings associated with opioids. It can also help stabilize your mood and provide some pain relief. However, you may also experience short-term effects, including dizziness, constipation, rash, itching, changes in appetite. These side effects will go away in a few days or so. However, you must contact your Suboxone doctor if one of these side effects persists, as it can be a significant health risk. Short-term side effects are something that may naturally come when taking medication. As long as you don't feel any excruciating pain or discomfort in general, then it is likely that the short-term effects will dissipate in time. Over time, the long-term use of Suboxone can lead to physical and psychological dependence. Although that is not as common as other opioids, it can still happen due to misuse. If you suddenly experience any side effects after taking Suboxone for an extended period, you must consult with a doctor as soon as possible. Suboxone is less addictive than methadone and other opiates, such as heroin. However, there is still a potential for dependence. It can be slowly controlled with the help of cognitive therapy and other forms of psychosocial treatment and rehabilitation as holistically as possible. Qualified and licensed healthcare professionals will guide you to help control the addiction. The long-term effects of taking long-acting opioids may be quite scary, but you can avoid them and manage them with proper and comprehensive Suboxone treatment. If you show any side effects of drug addiction, you must consult with a Suboxone doctor or your primary care provider as soon as possible. Many treatment options can help you manage these side effects. The best ones are available at your fingertips with telemedicine. At SuboxoneDoctor.com, you can find Suboxone treatment centers and doctors with a click of a button. You can also find a Suboxone center in your vicinity. Suboxone treatment may be a challenging journey, but it is worth taking. With the help of qualified and compassionate Suboxone doctors and primary care providers, you can be on your way to a life outside of addiction and be given the tools necessary to succeed. Remember, if you display any severe side effects, do not hesitate to seek help. Many resources are available to those struggling with addiction, and Suboxone treatment is one of the most effective methods to help permanently end addiction. With the help of a qualified Suboxone doctor, you can finally be rid of your addiction and start living the life you deserve. At SuboxoneDoctor.com, we pride ourselves on ensuring that your life is safe with our certified and compassionate Suboxone doctors and staff to give you the appropriate help you need both in and out of treatment. We aim to ensure you are comfortable and confident with your decision to seek help. We will provide you with the best possible care. We understand that addiction is difficult to overcome, but we believe it is more likely with the right support system. Visit our site today and take the first step to your future without addiction.